if you've listened to some of the other videos, you've seen that early life health really matters. Conditions of children in the womb have large effects on their later life outcomes in terms of mortality and education and income. And so as the historian, co-organizer of this workshop, I'm really interested in how early life health has changed over time and in the historical dimensions. And there have been some really interesting historical studies done on kind of these links. And I think one of the most interesting is a paper by Doug Almond that shows that children who were in the womb during the 1918 flu pandemic, which killed about 3 to 5% of the global population, had significantly lower educational attainment and income relative to cohorts who were born children who were born just before or just after that epidemic. But one of the issues with those kinds of papers is that the 1918 flu pandemic doesn't happen every year. And so as historians, we need to kind of try to figure out how early life health has changed over time. And so that's one of the things we're really going to be focusing on as well in this workshop. And really looking at a number of indicators. So rather than just focusing on birth weight, we'll be looking at at stillbirth rates, at neonatal mortality, which is children who die within the first month of their life, and kind of trying to see how those things have changed over time. And the puzzling thing about these trends is that they actually, they don't always match up very clearly. So birth weights, at least in the Western world, seem to have been fairly constant over the last 150 years. Whereas stillbirth rates and neonatal mortality rates have declined substantially, which would suggest that these early life health conditions have been improving. So we're going to be working to kind of try to solve that puzzle this weekend.